Here I have a 54-year-old female. She says that she's been feeling unusually tired and noticed some increased swelling in her legs. She says that this has been going on for 3 weeks. She also has some bilateral lower extremity swelling and occasional shortness of breath. She reports that the swelling worsens throughout the day and improves slightly overnight. The fatigue has also been progressively getting worse and has been affecting her daily activities. There has been no significant changes in her diet or exercise that she has noted, and she's not taking any medications besides the one that she's taking right now. Her past medical history includes hypertension and hyperlipidemia. She takes lisinopril and atorvastatin. She has no known drug allergies. She's not a smoker, drinks occasionally, and she works as an office manager. Her family history includes her mother had a history of heart disease. Her blood pressure in office was 140/85, heart rate 78, respiratory rate 16, temperature 98.6, and oxygen 96% on room air. She looked alert. She was cooperative. She wasn't in any acute distress. Her heart rate was regular, and her rhythm was regular. There were no murmurs. Her lungs were clear bilaterally. There was no wheezing or crackles. However, there was some bilateral pitting edema to mid-calf, but there was no erythema or warmth. Her labs showed that her CBC was normal. She had elevated creatinine, but her electrolytes were normal. Her BNP was 150. This can suggest congestive heart failure. The patient's symptoms of fatigue, bilateral edema, and elevated BNP could suggest possible heart failure. She also has hypertension, which looks like it's been poorly controlled, and may be a contributing to the cardiac strain. Also, some chronic kidney disease because of the mild elevation in creatinine. It can possibly be related to heart failure or hypertension. My plan for this patient is to start furosemide 20 milligrams daily for the edema and adjust the lisinopril dosage based on the blood pressure reading and the renal function. I would also schedule an echocardiogram to evaluate the ejection fraction and cardiac function, and follow up with renal function tests in 1 week. I would discuss the importance of fluid and sodium restriction with this patient and educate on recognizing worsening symptoms such as increased shortness of breath and weight gain. This patient should follow up in 1 week to see her symptoms and lab results. If symptoms worsen, we may consider an immediate evaluation.